Hi, my name is Tish, and in today's episode, we are going to be discussing and outlining the effects of the menstrual cycle on women's health. So if you have a partner, or perhaps you know someone, a friend, who struggles with bouts of anxiety, depression, addictive behaviors, binge eating, irritability, if you or you know someone that experiences low self-esteem, negative or intrusive thoughts, if you have difficulty maintaining concentration or experience dips in your energy levels or bouts of fatigue, then keep watching. So the menstrual cycle is divided into two distinct phases. The phases are characterized by two ovarian hormones. You may have heard of them, estrogen and progesterone. So two phases, two hormones. There are other hormones involved, but in this discussion, we are focusing on these two. These are the two primary hormones associated with each phase. It's worth noting that these hormones behave in a predictable way for each cycle. Cycle is, if you aren't clear, it is from the day of your period to your next period, which on average is about 28 days. It can be a few days more, a few days less, but this is the average for most women. So phase one, the first phase, is called the follicular phase. This represents the first part of your cycle, so from the first day of your period to ovulation. Ovulation is the midpoint. This typically lasts around 15 days, give or take, and the primary hormone is estrogen. The second half of your cycle is called the luteal phase. This follows ovulation and ends just before menstruation. This typically lasts between 12 and 14 days, and progesterone is produced throughout this phase. So these phases, namely due to the hormones associated with them, influence a woman's mental health through a variety of mechanisms. But before we dive into that, let's learn a little bit more about the names of these phases and their origins. I remember when I first learned of this, it was a little bit confusing. So the follicular phase, phase one, gets its name because follicles release eggs for fertilization. If you don't know what a follicle is, it is a sac of fluid in the ovaries that contain eggs. Once these eggs are released from the follicle itself transforms into what is called a corpus luteum. Once this happens, you then enter into that luteal phase, that second phase. So ovulation is the midpoint between these two phases. Fun fact, the corpus luteum produces progesterone. This maintains the lining of the endometrium. This is a really difficult word. Endometrium. So that an embryo can grow. This is what you shed during menstruation if fertilization doesn't occur. The luteal phase in this way is very similar to early pregnancy. So if you are quite sensitive to the effects of progesterone, then you can be sure to look forward to 12 weeks of it in early pregnancy. So let's take a more of an in-depth look at these phases and their corresponding hormones, and let's compare these hormones with testosterone. Just for contrast, testosterone is the male equivalent. However, testosterone doesn't drop like estrogen does. And I'm going to share my screen so that I can illustrate this for you. Here we have a typical menstrual cycle. So this happens in women every month, and this begins in puberty or from puberty. We can see that the green line indicates estrogen, whilst the red line indicates progesterone. This is the first phase, the follicular phase. So this is where you would get your period. Once you have had your period, estrogen levels begin to rise and then peak. So this would be ovulation. Once that happens, then those levels begin to decline, and then we can see the significant increase in progesterone in the second phase. So this is the luteal phase. Progesterone remains elevated throughout that phase. If we compare progesterone with estrogen, we can see that estrogen is relatively low throughout the entire 29 days. In fact, it only increases for a short period of time. It doesn't necessarily remain elevated for very long. I would say this is about 1/3 of the entire 29 days. If we compare that with testosterone, we can see that testosterone levels decline annually, and they only really decline from the age of, let's say, 50. But before then, you can see that those levels are generally stable. Males don't go through the motions of estrogen, and they don't experience the negative effects of progesterone. So this is the hormone that is associated with PMS. I should also say that this happens about 7 days before your period, so you will experience symptoms associated with PMS for up to a week, perhaps even 8 days before your period. So not only is there this energy deficit, which is happening on a monthly basis, but estrogen also declines in women with age. Because this is an annual decline, this testosterone, it's far more easy to acclimatize to those lower energy levels. So how do these varying levels of progesterone and estrogen affect our mental health? Before I get into this, I just want to preface this and say that the intention behind these videos are to raise awareness, because as females, we try to live up to a system designed by and for men. And so if we can begin to recognize the significant differences and deficits, we can start to create systems that nurture health and well-being within our society. So let's take a look at estrogen in more depth. Now, what does estrogen do for the female body? Energy is the primary function, but estrogen also regulates things like serotonin. So serotonin, it has a mood boosting effect. Your baseline for optimism is far greater in the follicular phase. When you have more estrogen available, you can experience the same set of circumstances in your luteal phase, but struggle to remain positive during this time. Other things that estrogen regulate is oxytocin. Oxytocin promotes pro-social behavior, connection, and empathy, and because you have more energy at this time, you're likely to be more social, and this too will upregulate this hormone. Dopamine is another neurotransmitter which plays a role as a reward center. Again, if you have more energy, you're more likely to get more stuff done, feel that sense of accomplishment, further motivating you to set more goals. So goal setting. Goal setting is increased during this time. You're more likely to make better decisions. You have far more clarity. Your cognition is on point. You're particularly resilient during this time. These are just the few effects of estrogen. Or when I think of estrogen, or I think of the follicular phase, performance comes to mind. However, as mentioned previously, estrogen only remains elevated for around 10 days out of a full 28-day cycle. So performance outside of this time will be negatively affected. It's also worth noting that estrogen declines with age, so you get somewhat of a preview of what you can look forward to in the luteal phase. Now, let's take a look at the luteal phase, which is the second half of the cycle. This follows ovulation and leads to menstruation, and typically lasts around 12 to 14 days. The first few days of your luteal cycle, your estrogen significantly drops, and so do your energy levels. Progesterone then begins to rise shortly after this. Once it does rise, it peaks and remains elevated and then tapers off just before your period. So at this point, so in your luteal phase, you have significantly lower energy reserve because your estrogen it decreases. It does rise, but it's not very high. You have lower energy as well as high levels of progesterone. So let's take a look at some of the effects of progesterone and low estrogen. You're likely to experience irritability, confusion, low self-esteem, anxiety, depression during times when progesterone are elevated. Melatonin also has a reduced hypothermic effect during this time, so you're likely to experience sleep disruption, concentration, focus. The ability to problem solve is reduced. You're far less motivated. We spoke earlier about how estrogen regulates dopamine. So goal setting, this isn't necessarily time for goal setting. Many women also report increased interpersonal conflicts with their partners, reduced social engagement. You're more likely to engage in addictive behaviors as a means of seeking comfort. Joint pain increases at this time and your strength declines, so you may notice that you're not consistently working out or wanting to even work out. Your immune system is lowered during this time, so it's a good time to set boundaries against possible stresses. In the presence of stress, progesterone is converted to cortisol, which further increases your stress response. And again, this has many implications, but it impairs things like cognition and emotional processing. If you are sitting an exam in your luteal phase, you're at a huge disadvantage. Personally, I don't believe that it's too difficult to allow females to book onto exams when progesterone levels have stabilized. Same with competitive sports. Studies also reveal that if you have an anxious personality, if you have addictions, if you suffer from PTSD, depression, these sorts of psychological disorders are exacerbated during this time. So I invite you to go on strike in your luteal phase. Ask for relief during this time because your body is clearly not wanting to perform. We can coin this luteal relief. And this isn't an invitation to mask the problem, the quote unquote problem with pills. we're very good at masking things in our society, but more so to honor the body as a female. It's doing what it is meant to be doing, but it needs the space and acknowledgement to do that. Because if you don't, it has negative implications on your health and your relationships. So, to start summarizing, menstrual symptoms begin roughly around 4 days after ovulation, not a few days before your period as previously suggested. In fact, a few days before your period, both of these hormones have stabilized. And in fact, women report feeling far better than they did 5 days ago when progesterone was rising. Yes, you may experience abdominal cramps on your period, and this is because of these hormone-like compounds called prostaglandins. These help to contract the uterus so that you can shed that inner lining that we spoke of earlier. This also takes place in pregnancy, perhaps not to the same degree. These varying levels and the ratio between progesterone and estrogen dictate symptom expression. To put it simply, estrogen is your energy. It's highest in your follicular phase and lowest in your luteal phase. Because you have less estrogen, you have less dopamine, less serotonin available, which may drive impulsive behavior, and you might experience bouts of depression, isolation. Pre-existing medical health problems are exacerbated during the luteal phase during this time. So I hope that's highlighted some important points for you to consider. Let us know your thoughts in the comments below. What symptoms do you struggle with most? Do you notice a dip in your mental health? What systems should be put into place to support women live happier and healthier lives? Send this video to a friend, send it to a partner. Don't forget to like, subscribe. Let me know your thoughts, and I will see you in the comments.